So this lecture will serve as your training for the standardized patient program for patient and interprofessional communications here at Wingate University. So an overall summary of what you'll be doing in your first case is you'll be a patient at a community pharmacy, so somewhere like Rite Aid, Walgreens, CVS, your local independent pharmacy. And you as a standardized patient are going to approach the pharmacy counter asking if a product is best for you. So the product that you're going to be asking about will vary based on what room and what patient you have been assigned to serve as sort of a standardized patient for, and that case will be emailed to you along with this training. The pharmacy student that you're going to be serving as a standardized patient for is going to conduct an interview that's going to collect information about your symptoms, and all of those symptoms and responses are provided in your standardized patient script. So it's really important that you review the script in advance and ensure that you are comfortable with those symptoms. If you have any questions or concerns about how you should respond, that you contact us. And then also making sure, just from a sort of realistic standpoint, that you have some familiarity so that you can ad-lib and provide some of those responses to students without having to read the script verbatim. So when you look at your role as a standardized patient, as again, you're going to have a script emailed in advance to you. So it's really important, as I mentioned, that you are familiar with this script and that you know the patient and sort of their condition and what they're experiencing. You do not need to know the responses verbatim, but you do, again, want to know them and hopefully be able to provide the majority of your responses as the student is asking you versus reading the script. So again, this script is the patient that you will be playing, for lack of a better word. So this is the case that you're serving in with all the information that you should provide when students ask you questions. We will also have copies of that script available for you the day of. So again, you don't have to have it 100% memorized, but it is good if you know it well and can provide a lot of the answers without reading the case directly to make it flow a little bit more naturally and feel like a true patient encounter for our students. What's really important is that you provide the patient's name, the patient's date of birth, the patient's medication history. So a lot of standardized patients, when you get asked your name, their sort of knee-jerk reaction is to provide their name or date of birth. And even if you correct, that really can throw students off. So please at least make sure that you know the basics of the patient name. And we've chosen names that can be both a male and female name, since we have both for standardized patients, and that you know the date of birth. And again, it's really essential to not provide any of your type of health information, your medications, one, because we want to respect your privacy, but two, that may really change sort of the tone of the case and throw students for a loop. A few key do's and don'ts is, so you do want to act like a patient. So, it's okay if you act a little confused at times. Patients are going to hear terms, especially if our students use very medical terms that they may not be familiar with. So it's okay to respond with, sort of a raised eyebrow if you hear a word that you're not familiar with, as you would if you were a patient at a community pharmacy. Also, if you don't understand a term when students give you a chance to ask questions, you can certainly ask for clarification, because we do want these to be simulations of what students should expect in real life. Students are trained, not all of them will, but most of them will ask you to repeat back information that they shared. And so it's okay if you can't remember it perfectly. Again, patients in real life aren't going to remember everything perfectly, so you don't have to stress about providing everything back to the student that they shared with you, and that's the purpose of having them do what we call the teach back, is so that they can clarify points that patients may have forgotten. Again, you do want to ask questions if you are confused when students give you an opportunity to ask questions. So again, if they said something that doesn't make sense to you in real life, patients are going to ask potentially clarifying questions. So it is appropriate when students give you the opportunity to ask questions for you to ask a question We don't want it to just be students ask, do you have any questions, so that they get trained to do that, and then you feel like you can't ask anything. So you can, as a standardized patient, ask any clarifying questions, but you do want to be as consistent as possible in the questions that you pose of students. We want this to be a standardized assessment so that it's as fair and sort of equivalent and equal of a playing field from student to student. And so please do try and have, one or two questions that you ask of every student, unless the student was clear on that information or maybe didn't provide that information. A few key things that you should not do is, while it is fair and appropriate for you as a standardized patient to ask questions, you don't want to ask overly confusing or challenging questions of students, as this can really throw them off and make them nervous. So we really try and find a balance of making the simulation real life, but not putting too much stress or pressure, throwing too much at them, because students are very nervous and this is their first standardized patient encounter in the curriculum, so they are particularly nervous for this assessment. You also don't want to overly respond with confusion or misinformation when students ask you to repeat back information or the teach back. So again, trying to not throw them for too much of a loop. What's really important, and a lot of our SPs want to do this because they want to see the students do well, is you do not want to prompt students for missing information that you know they need to provide. So after you go through a few of these assessments, you'll become well versed, you know what questions are coming, and you know what type of information the students are going to provide. So if you notice that a student hasn't asked you a key piece of information that all the other students have asked, please do not prompt them, because that sort of gives them an unfair advantage in the assessment. So if students aren't asking you something, they don't ask you your date of birth, don't provide it. They don't ask you about the location of your symptoms, do not provide it. Only provide them information that they directly ask you a question about. And we know that you're going to go through a lot of these. Most days you're going to have 6 to 8 students that you're going to see, so it's hard to keep track from student to student sometimes who provided what information. So as best as you can, try to not mix up what one student provided versus another when you're doing teach back, when they're asking you to share information they provided, because this can be another way that you can prompt students for things they haven't done and sort of give them an unfair advantage for the assessment. So wrapping up, day of logistics, please make sure that you arrive no later than 1:30 p.m. so that we can get everyone in the rooms. We can train you on how to record the sessions with the students and address any last minute questions that you have. It is essential that you keep this commitment and let us know as much in advance if you cannot attend for any reason. We certainly understand, illnesses, certain things come up. But if we don't have standardized patients, then we're really in a pickle for getting these assessments completed for students, and we can't reschedule them another day because a lot of times students, during the free time that we schedule these, have work commitments and such. The assessments are going to start at 2 p.m. and then depending on the day and how many students we have scheduled, you'll need to be present until about 3:30 or 4 o'clock. As mentioned, you will be responsible for recording the counseling sessions. Faculty are not in the room, so we grade these after the assessment via video, but directions are in the room, and again, we'll show you how to record day of to make sure you're comfortable with that. It's very simple and straightforward. And then you will also complete an evaluation of the student and their counseling skills from the perspective of a patient. So if you have any questions, contact information is listed here. If you have a question about scheduling or need to change your scheduling, Carol Arant is the best contact. If you have questions about payment or day of logistics, Laura Happy, who's the course coordinator, is the best contact. And then if you have questions about information that is in the case and want clarification, Courtney Mossban or myself is the best contact as the case author. Thank you again for your commitment in serving as a standardized patient for our students. And again, please feel free to reach out as you go through the case if you have any questions or concerns.